Reviewing an Education, Health and Care Plan, also known as an EHCP. What is an annual review? If a child or young person has an education, health and care plan, the local authority must review the EHCP at least once a year. For children under 5, the review should take place every 3 to 6 months. If there are concerns about progress, the review may be brought forward. The review must focus on progress towards achieving the outcomes or goals as set out in the EHCP, and must also consider whether these outcomes remain appropriate. From Year 9 onwards, the EHCP should focus on preparing for adulthood. Parents and young people should see annual reviews as an opportunity to get things changed that are not working as expected, to add in new concerns or needs, and to update their aspirations, as well as, if necessary, the outcomes. The annual review is a legal process, which means certain things need to happen before and after the annual review meeting takes place. Before the meeting. In the 4 weeks before the meeting, the head teacher or principal must request updated information and advice about the child or young person. This must be requested from you. The school or college may give you a form to use, or you can find it on the local offer. From the child or young person. From any professionals involved with the child or young person, as well as teachers, tutors, and those included in school assessments and observations. The head teacher or principal must send invitations and copies of all the information and advice gathered and invite further views and comments from those who are unable to attend. The following people must be invited: the parent, carer or the young person, a relevant teacher who may be the class teacher or form tutor, a SENCO or some other person responsible for the provision of their education, a representative from the local authority. Your EHCP coordinator will be invited, however they may not be able to attend every review. If you have any concerns, make sure you contact them to let them know that you would like them to be there at the meeting. A health service representative and a local authority social care representative, as well as anyone else that the head teacher or principal considers appropriate. It is unlikely that everyone invited will be able to attend the review meeting, so the head teacher or principal should try to ensure that the date of the meeting is convenient for you and for those people who it is really important to have there. What happens at the annual review meeting? The review meeting must focus on progress made towards achieving the outcomes set out in the EHCP, and on what changes might need to be made in order that the support provided will still help them achieve these outcomes, or whether changes are needed to the outcomes themselves. The EHCP must be looked at to see if it still meets the needs of the child or young person. The meeting will normally include the following: the extent to which the outcomes in the EHCP have been met, discussion around medium and long-term outcomes and if they're still appropriate, checking the support detailed in the plan is still appropriate, any further support required and who will be responsible for this, whether the EHCP needs amending or is no longer needed, review or requesting of a personal budget. For young people over 18, the local authority must consider if the training or educational outcomes have been achieved. And from Year 9 onwards, there must be a focus on preparing for adulthood. If you do not agree with what is being suggested at the meeting, try to make that clear and contact your EHCP coordinator after the meeting to make sure that they are aware of your views. What happens next? Within 2 weeks, the school must collate the completed annual review paperwork, including the details of what was discussed at the meeting, and send it to everyone invited to the meeting and the local authority. The report must set out recommendations on any amendments or changes required to the EHCP and should refer to any differences between the school's recommendation and those of others attending the meeting. Within 4 weeks of the meeting, the local authority must write to you to let you know their decision, which can be one of the following 3. Keep the EHCP as it is, maintain, amend or change it, or cease to maintain it, and the reasons why. The letter must also tell you about your right to appeal that decision and the time limits for doing so, the requirement for you to consider mediation should you wish to appeal, and the contact information for the mediation service and Norfolk Send partnership. This is the end of the annual review process. What happens when the local authority proposes to amend the EHCP? The local authority must send you a copy of your child or young person's existing EHCP and an accompanying notice detailing the changes they are going to make. They must also send you any supporting evidence or information that details the changes needed. You have 15 days to consider and make comments on these changes, including requesting a particular school or other institution to be named in the EHCP. You can ask for a meeting with your EHCP coordinator to discuss the changes. If the local authority decides to go ahead with making the amendments, it must issue an amended EHCP within 8 weeks of the original notice. This should clearly show which parts have been amended, include the minutes of the annual review meeting, and any relevant reports should be attached. If the local authority decides not to make the changes or amendments, they must inform you, giving reasons, within 8 weeks. The local authority must tell you about your right to appeal that decision and the time limits for doing so, the requirement for you to consider mediation should you wish to appeal, and the contact information for Kids Mediation Service and Norfolk Send Partnership. What happens when the local authority proposes to cease the EHCP? The local authority must inform and consult the child's parent or the young person and the school or other institution that is named in the plan. If, following the consultation, the local authority decides to cease to maintain the EHCP, it must notify the child's parent or the young person, the institution named in the EHCP, and the responsible CCG. They must also tell you about your right to appeal that decision and the time limits for doing so, the requirement for you to consider mediation should you wish to appeal, and the contact information for Kids Mediation Service and Norfolk Send Partnership. Support should not be withdrawn before the end of the current academic year, and if the child's parent or the young person disagrees with the decision, the local authority must continue to maintain the EHCP until the time has passed for bringing the appeal or until an appeal has been concluded. Reviews before transition to another phase of education, for example starting primary school to secondary, or secondary to post-16. There must be very early planning about which school your child or young person moves on to. Start to look at schools early. Look at the prospective school or college's SEND information report, which should be on their website. See our booklet Finding Out About a School, which is also on our website. EHCP reviews will be held before a child or young person's last year in their current school because the review process must be completed by the 15th of February in the calendar year that they transfer to their new school, or the 31st of March for young people who are in Year 11. You will then have time to appeal if you disagree. Annual reviews from Year 9, age 14, onwards. What is a transition plan? From Year 9 onwards, annual reviews must include a focus on preparing for adulthood, including employment, independent living, and participation in society. When a child is in Year 9, a transition plan will be drawn up as part of the annual review. The plan helps children and young people think about their future, including GCSE options or alternatives, and what they would like to do once they are 16 and beyond. This transition plan also looks at the child or young person's aspirations and needs as adult life approaches, and must be built into EHCP. The transition plan is updated at each annual review meeting until they are 25, that being if they still have an EHCP. The review must include higher education and/or employment, exploring different employment options such as support for becoming self-employed and help from supported employment agencies, independent living. Young people have choice, freedom and control over their lives, their support and their accommodation and living arrangements, including supported living. Participating in society, having friends and supportive relationships and participating and contributing to the local community. Being as healthy as possible in adult life. Who will be involved? The school will provide information about the learning programme of support. Schools also have a duty to provide independent and impartial careers guidance to children and young people. Children and young people will be able to say what they feel their needs are and what they would like to do after leaving school. Their views, wishes and feelings should be recorded. Parents and family will be able to give their views on what they would like for the child or young person after they leave school. They can also discuss what practical help may be needed and how they can support them in developing the personal and social skills needed in adult life, including the possibility of a personal budget. Social care, so that arrangements can be made for any assessment under the Disabled Persons Act 1986 and or the Care Act 2014. The health service will also be involved and they will provide advice on the services that are likely to be required. Finally, a post-16 institution representative should be invited, especially if your child or young person has expressed a desire to attend a particular college. What happens next? All 16 to 19-year-old young people will be expected, but not required, to be in some form of educational training, full or part-time. This can continue until the age of 25 for those with an EHCP, and this should continue to address their needs and aspirations. This does not mean young people have to stay at school. They could, attend full or part-time education at college, take up an apprenticeship, take a traineeship or supported internship which involves work experience and study, or go to work, the EHCP will then cease. There are helpful booklets and information about preparing for adult life on the SEND local offer website, which is www.norfolk.gov.uk/send.